Semua ada dah. I nak tahu your group mana sebenarnya ni?
Subgroup 2.
You pernah ambil sebelum? Belum.
Session dengan Datuk? Belum. Ni first session untuk jadual baru ni.
Iya. Tak, I confused betul. You group apa?
Subgroup 2 untuk group 2.
You block mana ni?
Block 1. Block 1 kan?
Group apa? Subgroup apa?
Group 2. Subgroup 2.
Year 3.
Year 3.
Program you all?
10 dalam subgroup ni.
Ini baru masuk pitch posting ke? Atau you start pitch posting bila?
We start paid posting November hari tu. Bulan November macam tu. Lepas tu dah rotate pergi IM. Lepas tu dah patah balik pitch.
November.
Our first posting is paid.
First posting pitch ya? Bila you masuk?
Tarikh baru kena postpone lagi.
You masuk bila? Mula-mula bila?
Sepatutnya hari ni.
Tak. You masuk pitch mula-mula dulu.
November.
November. Masa tu you kasih lecture untuk prosedur semua yalah tu saja kan? Tak ada teaching, tak ada clinical teaching.
Tak ada.
So you masuk balik this one.
Yes.
Block 1 2 3. Okay. You would start bila you start pitch posting hari apa minggu ni? Hari ni?
Isnin minggu lepas.
11 hari bulan.
11 hari bulan. 11 hari bulan.
Block 1
Yes.
Before that block apa?
Internal medicine.
Before that pitch group apa? Block apa?
Block 2.
2 minggu juga?
2 minggu juga. 2 minggu juga.
Block 2, year 3. So tu block 2 . So diorang start masuk blok tu $28 bulan dia orang masuk Blok tu dia masuk berapa bulan? Blok
28 Disember.
ha?
28 Disember. Betul ke ni? Betul lah. Yes. Blok tu hari tu masuk 28 Disember. Lepas tu blok 1 masuk balik 11 Januari.
Okay, so I ambil group you all. So I ambil lagi group. You apa group ada? 4.
Ada 4 subgroup.
You habis bila?
Jumaat ni.
So I ajar 3 blok sajalah ya. Late.
Test mic. Boleh dengar ke? Okay.
Boleh.
Uzan, siapa Uzan?
Saya Dr. Okay. Saya Muhammad Suhaib bin Muhammad Abdul. Okay, start the presentation. Bismillahirrahmanirrahim. Okay, for the chief complaint, Afiq, 8-year-old and 1 month old Malay boy was admitted to the pediatric ward. 8 years old. 8 years old Malay boy was admitted to the pediatric ward of IUMC due to rapid breathing for 1 day prior to admission. So for the HOPI, the history was recorded, was obtained through the mother, and then the mother claimed that this child, her child had rapid breathing until 1 day prior to admission. So he started to experience rapid breathing in the early morning, soon after he woken up. So nevertheless,
Kenapa
he
you
still
ambil
went
kes
to
tu
school on that day.
ni? Tak ada kes lain ke?
Case lain.
So, siapa choose kes ni? Semua rapid breathing. Di 3 episode semua rapid breathing. You choose kes macam mana? Ha?
From majority vote.
Ha? Ya?
Majority from the majority vote of the member.
Kenapa pilih kes yang ni?
For this case.
Tak ada kes lain? I dah boring dah sebab semua kes yang dah dengar rapid breathing. Group apa tadi? Group 2. Siapa nama you?
Suhaib, Muhammad Suhaib bin Muhammad Abdul.
Mat Suhail.
Suhaib, yes.
You memang kes lain tak ada? Sebelum ni tak ada kes?
Kejap.
You dapat ni pada mana?
Cari kes baru.
Ni
daripada kes write up senior.
Ya, kenapa you choose kes rapid breathing? Ada sebab?
It was a collective majority vote daripada semua orang.
Berapa kes yang dia bincangkan, yang you present, berapa kes you discuss tu yang supaya nak choose? Kes apa lagi? Rapid breathing lagi?
Sebelum ni ada discuss congenital yang minggu lepas.
Lain kes asma ke, kes nephrotic syndrome ke, kes AGN ke, tak ada?
Yang ni kes ni tentang asma. Yang the one that the case is the rapid tentang asma ni.
Okay lah. Kita start semula. Because I dah sebelum group 5 pakai rapid breathing, pun boring jugalah. Tak challenging lalu. Start semula. Kita tahu lama-lama you pun. Start semula.
Okay, for the chief complaint, Afiq, an 8-year-old and 1-month-old Malay boy, was admitted to the pediatric ward of IIUMC due to rapid breathing for 1 day prior to admission. So the history was obtained from his mother. So the mother claimed that the child had rapid breathing until 1 day prior to admission. He started to experience rapid breathing early in the morning, soon after he woke up. Nevertheless, he still went to school on that day, but the rapid breathing became worse. Since the teacher forgot to inform the mother about his condition, Afiq had to wait for his mother to pick him up after school ended at 3 p.m. So that was when the mother noticed that his rapid breathing was worsened, and at the same time, he was crying. His mother also noticed that there was a subcostal recession as well as a loud wheezing sound when he expired. He also complained of having chest tightness. Without further ado, the mother took him to the clinic Putra Medic, and the doctor gave him a nebulizer for 2 times. But the rapid breathing still persisted. He then was brought to the emergency department of IIUMC. A week before he had this rapid breathing episode, he also acquired a cough and a runny nose. And it was a productive cough with phlegm, and the phlegm was clear. The coughing was during the night. So there was no unusual sound heard by the mother when Afiq was coughing, and discharge from the runny nose is clear. He also had an episode of post-tussive vomiting, where the vomitus mainly composed of phlegm. Otherwise, there is no fever and rashes was noted. So last year, Afiq was newly diagnosed to have asthma, as he had the same symptoms, which are rapid breathing, coughing, and runny nose. At the same time, his mother brought him to the clinic Bukit Sekilau, and he was given nebulizer, and the rapid breathing resolved. In this year, Afiq had the same symptoms for twice, and the rapid breathing was relieved after using the nebulizer. Furthermore, he had eczema on his leg since last year, which caused him pain on walking. So the eczema was still present until now. According to the mother, Afiq had allergic rhinitis since he was 4 years old, and including his father and other siblings are also have allergic rhinitis. So that's the end of the HOPI.
HOPI.
Yes. Should I continue for the systemic review?
Akmal lah, any question?
I would like to ask if this patient have fever prior to admission.
It is stated in this HOPI, there was no fever and rashes in this patient.
Atira?
I would like to ask about the past medical history, if this patient had any previous medical condition.
Okay. For the past medical history, the patient had episodes of rapid breathing last year, and he was brought to, like I mentioned, he was brought to the clinic Kesihatan Bukit Sekilau. And then at that time, he was diagnosed.
You think
yes?
the cause of the rapid breathing last time is due to what?
I think that the last time it was due to his allergic rhinitis.
Allergic rhinitis cause rapid breathing?
Last time he was that.
No, my question, allergic rhinitis cause rapid breathing. Apa yang you belajar sebelum ni? Allergic rhinitis cause rapid breathing.
It could cause for allergic rhinitis, there will be symptoms of coughing and wheezing and chest tightness, and also shortness of breath.
In allergic rhinitis, wheezing, shortness of breath. Depan mana you belajar?
That's in asthma.
So what the cause of what is the cause of rapid breathing previously? He has a few episode rapid breathing sebelum ni kan? You present kan? Betul kata
Yes,
betul?
he had the same,
Due to what?
Yes, he had an episode of. It was not mentioned what was
due
the
to
cause
what?
of the.
What do you think the cause?
Is it asthma before?
Asthma. If you think it's asthma,
He was diagnosed with asthma before,
so if you think it's asthma, rapid breathing previously, why you think it's past? You think it's not related with current shortness of breath? Rapid breathing? Do you think that the past shortness of breath not related with the current shortness of breath?
I think it is related.
Related, why it become past?
I mean, he had a history of past.
What you read about asthma?
Asthma is a chronic chronic inflammatory, and it's reversible. And the presentation is shortness of
It's chronic.
breath, coughing, wheezing, and chest
So asthma
tightness.
is chronic disease or acute disease?
Is a chronic inflammatory disease.
So it's chronic. So why is it anything
Yes.
related to the asthma should be in past medical history?
The past medical history, he was before last year, he was diagnosed with asthma and given nebulizer for it.
Yalah. Currently dia ada asma lagi tak? Currently he is still asthmatic or not?
The sign shows that he is asthmatic since he has a subcostal recession and also wheezing
listen
sound
to
when
me.
he
You
expires.
listen to me, Tuhai. You dengar elok-elok my questions. Currently he is asthmatic or not? Tell me about your
He is
asthma.
asthmatic.
Okay, he is asthmatic currently. So why is it the last year punya diagnosis of asthma is a past medical history?
Can you come again with that question, doctor?
He is asthmatic, is it? Currently he asthmatic. Betul tak?
Yes.
Yes or no? Okay, kalau currently dia asthmatic, why is it the past medical the last year punya history of asthma tu become past medical history? You faham tak logik tu? Kenapa susah sangat nak fikir tu? Dengan otak tu. Kalau dia dah asma, still asthmatic. You faham tak past medical history tu apa?
Asthmatic.
Then why that the history of asthma become past?
Oh,
Why is it history of asthma become past? It's chronic disease.
Presentation should not be in his past medical. Is that what you mean, doctor?
But what I mean, pakai otak lah. Think, because it's not apply for asthma only. Logic. You think about the logic. First, asthma is chronic disease. You have to be sure of yourself tau. I'm not telling you, but you have to be sure yourself. First, asthma is chronic disease. Satu. Nombor dua. He was diagnosed asthma a year ago. Nombor tiga. Currently, the shortness of breath probably related with asthma. So all the story of asthma is about the story of asthma. So the asthma is current or past? Tak pernah jumpa orang tak fikir macam ni. So asthma is current or past? You ingat current tu 1 minggu, 2 minggu macam tu? Kalau orang tu hypertension, dia kena stroke because of hypertension. The hypertension tu history of past or current?
Current.
Apa beza dengan asma? It doesn't matter you got 4 years or 5 years of illness, chronic illness, but the story is the current. Faham tak?
Faham. So the past medical history should just be rapid breathing because he still have asthma. And past medical history is that he was brought to the previously last year he was brought to the clinic Bukit Sekilau due to this rapid breathing?
Bodohnya lah. Dengar, listen elok-elok. Because the current history is problem with asthma. Anything about the asthma become current.
Current.
Faham tak? Kata dia kena appendicitis. Dia kena appendicitis. Operate. No. Then they come in because shortness of breath. It's no more appendicitis. So the history of appendicitis will become
The past.
past. Tapi this child is asthma for the past 3 years, 4 years. No, they are admitted because of most likely asthma. Now, so all the history of asthma become
Current.
current. Doesn't matter a year ago ke, 2 years ago ke, 3 years ago ke, doesn't matter. Because the history is history of present illness. Illness ni, doesn't matter. Asthma is illness. Dia tak cakap asthma dan history of present illness ni masuknya dalam 1 minggu, 2 minggu, faham? It can be goes 2 years, 3 years, since born, sampai lahir lagi tau. All is related to the current illness. So everything will become present. Faham tak?
Understood.
Susahnya nak sampai benda tu. So each disease will you have to decide when you clerk the case. When you clerk the case, you have to decide the case you clerk tu is the chronic illness or acute illness. If the child admitted because of diarrhea, no, but the child is asthma. So the asthma related tak dengan diarrhea tu? Chief complain tu?
No, it's not related to the
No.
diarrhea.
So it become a
past.
past because it doesn't related at all with the current
Asthma.
current diarrhea. Because your illness, history of present illness is about diarrhea.
Oh, okay.
You got to talk about diarrhea, all the diarrhea case. What the diarrhea all about? Because this patient come in with the chief complaint of diarrhea. Your job is to sort out the problem of diarrhea. That's your job. Faham tak?
Faham.
So the decision is depend on the chief complaint. Supaya kalau orang kena hypertension, dia kena stroke atau heart failure due to hypertension. Because it is a complication of hypertension. Everything about hypertension you need to know, so it become a issue present illness because the problem is the hypertension. So everything will become HOPI. You faham tak?
Faham.
That's how it's going to be. So in your case, the history of 1 year ago diagnosed as asthma, is it present in past medical history ke or HOPI?
Present is depression is currently current present.
Yelah, you become what? HOPI ke atau past medical history?
HOPI for the rapid breathing.
You see, HOPI and past medical history are different things. You cannot put a thing that HOPI become past medical history. You cannot put past medical history become HOPI because it's two different things. So a systemic review. If systemic review is part of HOPI, then you have to review everything positive, negative history of the case. If systemic review is outside the HOPI, anything not related with HOPI, you can put in the systemic review. But anything related with HOPI must go into the HOPI. And HOPI ada positive history and negative history. You understand or not?
Understood.
Kita go to that one, the 20 minit. Itu nak habis itu je. So, siapa tadi? Question? Balkis? Any question?
What is the medication history?
He was for the medication history. He took MBI salbutamol for the asthma previously as well.
So in salbutamol medication, using salbutamol, you think which one you want to put in dalam medication history ke or is in HOPI?
In medication history.
You can put in medication history. It's okay, but it doesn't look intelligent. Because you can also put in the
It's HOPI as well.
HOPI because we are talking about the compliance, the technique the technique is a proper, not proper, and so on. Dose proper, not proper. No, it's nothing wrong to put inside the HOPI because we want to know when the medication was started. It's okay to put in the medication history, but you see you disjointed. No, so you tak tahu bila start. No, you tak tahu you compliant sangat. You tak tahu, dia tak tahu masuk dalam part of the story. So kalau you smart, those yang smart, they will put inside the HOPI. Okay. Any other question? Nurul.
I would like to know if there is any significant events during the antenatal, intrapartum, and postnatal period.
So basically, you want to know about the birth history. So in the birth history, it will not be in the the HPI. So for the birth history, for antenatal, the pregnancy was uneventful. For the intrapartum, the patient was born at 38 weeks of gestation via spontaneous vaginal delivery, and his birth weight was 3.5 kilogram. And his postnatal, he was warded to the neonatal due to neonatal jaundice for 2 days, and then after that he had an episode of hematuria and was warded 3 days, and there was no serious complication.
Okay. That one okay to put in the birth history. But let's say if the child is BPD. You know BPD tak? Bronchopulmonary dysplasia. Tahu bronchopulmonary dysplasia? Tahu tak? Apa tu BPD? Dia chronic lung disease disebabkan oleh kerosakan paru-paru, disebabkan oleh premature lung yang premature, lung yang tak matang, menyebabkan dia budak tu boleh dapat chronic lung problem. Dia simptom ni seperti asma, tapi dia start very early in life. Kita panggil dia BPD. Kita panggil BPD. But they related with umur ketika dilahirkan. Sama ada 32 weeks ke 26 weeks ke lah. So kalau kes macam tu, the birth history will be where you want to put the birth history? Will be where? Where you going to put that?
In the HOPI.
In the HOPI, because that is the key of the case. Kalau you start, you letak dalam birth history satu, jauh nak tunggu benda tu sampai to understand the case. Baru faham. Tapi if you start early, this is a premature born, delivered at 28 week with birth weight of 800 gram, and then admitted to the ICU for 2 months because need surfactant and ventilated. And then since discharge, patient got recurrent shortness of breath. You faham tak? And because now admitted because another episode of shortness of breath. So the birth history will be the HOPI because the key is the key of the case. So what I want you to learn is that there's no fix, Problem with you all ni, you all suka fix sebab you rasa mudah. Tapi life are not like that. Because there are many scenario in life. Doesn't work. What life doesn't work. There's no such thing rule must be like that. Life ni bukan 2 campur 2 kali jadi 4. Mesti macam tu. So you have to decide. When you clerk the case, after you clerk the case, you sit down and you fikir about the case. What the case all about. To decide which one is a HOPI, which one is a not HOPI. So kalau you tu difficult, kalau you tanya fixed rule, apa dalam tu, it's very difficult. Because the case every case are different. Faham tak? Faham? Sebab tu the key of the case is 2 things. Chief complaint and HOPI. Usually that determine to pass or to fail you. Because the rest is maybe important, maybe just to complete the history complete. That's all. Most of the time we fail students because they unable to present the proper HOPI. Once they present proper HOPI, usually the other one we forgive here. Okay. We forgive here. Okay. Aiman?
I want to ask, is this patient have any allergic?
For this, the patient he is allergic towards seafood.
Maria?
I want to ask if hello, can you hear? I
Yes.
want to ask if the family has smoke, any of his parents smoke, because it can be
Smoker.
smokers. Smokers.
Smoker lah. Soal.
Okay. For the family, so basically, is this for the social history, right, and family history? So for the father, he does not. Hold on.
He does not.
He does not smoke. But for a little bit about the family history, the father have asthma and also allergic rhinitis, and his other siblings also has allergic rhinitis.
You rasa kalau dia masuk dalam HOPI, would it be look HOPI more complete?
Yes, it would be more proper.
More complete, is it?
Yes, because this is they have a family history.
It's not wrong to put in that, in the family history. But if you want to look your HOPI become more impressive, usually we just mention it in the HOPI. It's not wrong. We're not going to penalize you, but you can become a higher point student if you make your HOPI become more impressive. You understand what you mean?
Understood.
No, we're not going to penalize you. You put in the family history. But if you put you make your HOPI become more impressive, you have the higher mark. Understand?
Understood.
Any other question?
I would like to correct myself. Actually, for the father is a smoker, but he stopped smoking for 5 years, so he's an ex-smoker.
5 years old, 5 years ago.
5 years ago, I mean.
Why stop smoker? Tak tahu.
He did not mention why did he stop.
Because he did not mention. It was not noted inside
in the history.
If you baca tu. It depends how interested you not interested to know. If the person who clerk it, I was interested to know. I think because the asthma become the father asthma become more severe, that the father decide to stop. Okay, any other question? Any other question? No question.
Yes. Is there any? Did he have any growth delay?
Growth
Okay,
delay.
basically the growth and developmental history. So for that, his growth was normal, and he did not have any speech he did not have any speech delay, and he is able to write normally. So it's normal.
Why you worry about speech delay? Hmm? Why you worry about speech delay in this case? Are you worried about speech delay in asthma case?
Could it be that due to rapid breathing, it can affect how he talks.
Wow. You goreng ni? Eh?
Yes.
Why not you answer macam ni? I don't know. I don't know, and I just mentioned it because they asked me, but I don't know is there any relation or not with the asthma. Kalau cakap I don't know, you know why? Because I also tak tahu. I don't know. I try to figure out kenapa you cakap speech delay, you focus on the speech, you know, my brain works different. When you say something, I say, why is this fella talking about speech? When you talking about asthma, mesti ada something yang dia betul dia ni. Because apa tu, kalau you so basically I don't know. So why not you answer, you jangan goreng. Bila goreng macam ni, you tahu tak? I cakap, wah, dahsyatnya. It's something that even I pun tak tahu. Cakap I don't know. I just cakap because they ask the questions.
Okay. I don't know.
Yeah, I don't know because it was asked apa tu. Don't feel so guilty. Itu tak guilty. Guilty of wah you need to know everything. You rasa you kena tahu semua benda.
No.
So you only tell us talk what do you know. That is the safest thing to do in life. Used to tell us what do you know. Even everything in life are like that. You don't know, I don't know. Bahaya you create banyak benda dalam hidup you nanti. You the girl suka ke orang lelaki macam ni? You trust lelaki macam ni? Tak bahaya?
Bahaya jugalah.
Bahaya. You answer, the girls dah answer.
Oh, dia orang silent je.
I ask the girls because the men you suka men yang rolling pusing ni any other question?
Did he completed the vaccination schedule?
Yes, his immunization was complete.
Completed.
Yes.
Any other question?
Is it stated in the history that the rapid breathing is worsened when exercise?
It was not stated that that rapid breathing is worsening during exercise.
Any other question?
I would like to ask, what is his general appearance when he comes to IUMC? I mean, in condition that is he alert, is he conscious?
The child was conscious, alert, and active. He was pink, and but he looks tachypneic, and he was normally built. So he's alert, conscious.
Any other question?
What is
what is the respiratory rate in this child?
Well, his respiratory rate is 30 breaths per minute.
I want to ask, how is it this child ability to talk in this condition when he is admitted? Is he able talking in phrases or in words or in complete sentence or what?
So this patient was talking in phrases. So he was able to talk in phrases.
Lagi any question?
Can I know the other vital signs value?
So for his other vital signs, his blood pressure is 153 over 100 millimeter mercury. His heart rate is 112 beats per minute. His respiratory rate is 30 breaths per minute. His temperature is 37 Celsius, and his SpO2 is 100.
Any other questions? Akmal. Akmal, how bad is it the patient rapid breathing?
So if talking about
Ada tiga je, Akmal.
the severity, okay.
Mild, moderate, or severe.
I think this is moderate.
Why?
Because of that rapid breathing, he speaks in phrases.
Lagi?
And the respiratory rate appears to be slightly increased. Okay.
Slightly increased by tak moderate, mild.
No, sorry. The respiratory rate is increased. I'm sorry. Okay, and however, the SpO2 is 100. But I think
SpO2 kat mana?
Yes.
SpO2 dekat mana?
SpO2 of this patient.
Where?
Under room air.
Where?
What do you mean?
Where is it SpO2? Dalam ward, dalam A&E?
I don't know.
I don't know. If you want to know the severity of shortness of breath during admission, which SpO2 you want to know? In the ward or A&E?
In the ward.
In the ward. In the ward, patient dah masuk ward dan nebulize semua, everything semua. The patient nak masuk ward dekat mana? In ward ke A&E?
In A&E before.
In A&E. Yeah. So what is saturation at A&E?
I don't know.
Then I don't know. So what is the severity of shortness of breath when the patient admitted to the ward? Mild, moderate, or severe? For you, you think it's moderate because speed in phrases and tachypnea. Why can't it severe?
If it is severe, this patient might be talking in words rather than in phrases.
Okay, but is it enough that only to decide? Is there any other parameter can help you to decide?
We have 7 parameters in assessing the severity of.
What's the parameter?
The first is the breathless, dalam keadaan breathless while walking, whether in talking.
Second apa?
Second when talking.
Tak, first breathless. Second
talks in sentences, phrases,
lagi
or words.
talks in. Nombor 3
alertness,
lagi
respiratory rate,
lagi
the usage of accessory muscles,
lagi
wheezing,
lagi
SpO2 on air,
lagi.
pulse, and lastly the.
So what about this case? Can you put in one by one in this case? Breathlessness. How this case breathlessness? Is there anything that you can put in about breathlessness in this case?
No.
Talking?
In talking, it is not mentioned in the history. It is not mentioned in the history.
Yeah, Malaysia tak mention. So Sohaib, the talk macam mana?
I said that it talk in phrases.
Phrases. Lagi apa lagi? After talk apa? Alertness. Patient ni? Alert tak?
This patient appears to be alert as mentioned just now.
Alert lah, Sohaib. Dan history.
Yes, he was conscious, alert, and active.
Dalam history, bukan physical examination.
In history, I did not mention.
Because physical examination, you examine few days after patient admitted. So to your physical examination tak valid. Most of the time you examine a few days after admission, not the same day. Lagi apa?
The respiratory rate.
Tachypneic ialah. Lagi?
And then the usage of accessory muscles.
Ada usage muscle and history?
No.
Mak boleh nampak tak using accessory muscle? Can the mother notice if the child using accessory muscle? or intercostal recession, mother tak boleh nampak?
Yes, it is. In this case, it is mentioned that the mother noticed.
But naturally, usually mother boleh notice tak? You orang perempuan jadi nak jadi mak, boleh nampak tak kalau anak you ada using accessory masa? Boleh nampak? Boleh perasan ke tak boleh perasan?
Supposedly yes.
Mestikah you jadi doktor baru you perasan? There's some mother actually more observant than doktor tau. So can you get it in the HOPI by right?
With regards to the usage, that it is not mentioned, but the subcostal recession, there is there. It is mentioned by the mother.
You ni tak faham. So you all ni susah nak faham tau. I ask you the question, can the mother notice or not? Dia punya anak dia, not this case, in any case, anak dia ada subcostal recession using accessory muscle, mak boleh nampak tak?
Boleh.
You ingat doktor saja boleh nampak? Mak boleh nampak tak? Many mother boleh nampak, especially kalau the child tu dah 3, 4, 5 kali kena attack. So kalau mak tu boleh nampak, can it goes into HOPI? Yes, it can go to HOPI. Kenapa tak mention dalam HOPI? You rasa kalau mak ni, kalau you tak tanya, dia beritahu tak? Kalau orang yang tanya dia, anak puan ada tak boleh bernafas tu, nampak dada dia turun naik, lepas tu ada in between dia punya tegang leher dia ataupun dalam between tulang tu macam ke dalam. Kalau you tak tanya macam tu, rasa mak akan beritahu ke? Susahnya lah nak dapat.
No.
No, dia pun mak pun yes. Jadi soalan ni, I ask you question. Ada different tak? Katalah mak dia beritahu anak saya bernafas memang ada ke dalam, dada ke dalam bergerak dan leher dia tegang, atau anak mak saya beritahu masa dia bernafas mother
Assalamualaikum warahmatullahi wabarakatuh. Perhatian kepada semua dengan Sultan Ahmad Shah Medical Center, para pesakit dan pegawai sekalian. Waktu salat zuhur akan masuk dalam tempoh 15 minit daripada sekarang. Marilah kita bersama-sama menunaikan salat waktu kerana Nabi Muhammad SAW pernah ditanya, apakah amalan yang paling terbaik? Lalu baginda menjawab, salat di awal waktunya. Untuk maklumat, solat fardu boleh dilaksanakan secara berjemaah dan mengikut SOP yang telah ditetapkan. Adalah dimaklumkan bahawa tiada pegawai dibenarkan untuk melawat pesakit dalam tempoh PKPP. Hanya seorang penjaga dibenarkan untuk menjaga pesakit di ward pada satu masa. Sekian, terima kasih.
So you rasa ada beza tak kalau mak dia cerita kata anak saya bernafas dengan dada dia turun naik dengan ada dada masuk ke dalam, the mother told there is no nafas dia walaupun takib ni, but there is no accessory muscle usage. Ada different tak dari segi information yang you dapat? Ada different tak? Which one is positive history? Which one positive history? Which one is negative history? Dua tu penting tak? Penting tak dua tu? Ada dan tak ada, penting tak?
Penting.
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 Kedua equally important. That's why both positive history and negative history are equally important. Kalau tak mention, it means what? Kalau tak mention, most likely it means what?
Tak ada.
Dia tak
Tak ditanya.
Tak
Tak
ditanya.
ditanya.
It was not asked. If you why he didn't ask? The clerk, clerk apa dia tak ask?
Sebab obvious. Sebab dah obvious.
Because sebab the obvious, but that thing doesn't cross the person mind. Kalau cross dia punya mind, dia akan tanya ke tak tanya?
Dia akan tanya.
Because he didn't cross the mind. Why doesn't cross the punya mind?
Bagi dia mungkin tidak penting.
Ask yourself.
Hmm.
When you ask that question, what you want to look at? Mentality you all ni, you all tak tahu semua kan? You all tak tahu sendiri you all punya fikiran. You tak boleh search. Jarang muhasabah ni lah akibatnya. Itu muhasabah. Nabi pesan sebelum tidur tu muhasabah. So you search you punya fikiran. So the next day become better person. Doesn't cross the punya mind because dia tak tahu atau no intention to ask for severities, how severe the acute exacerbation. Kalau your mind dah ada dalam otak you ni, I want to assess the severity of this case, how severe the acute exacerbation. You count all the list 7 tu akan datang dalam otak you, and you will ask one by one to the mother. The mother will answer you, and then you will put in some other there is there or there is not there. So you faham, that's how we assess you all. You thought that it's just not what history, it's what inside your brain. Kalau you ada otak you want to memang assess how severe is it, you know the step, you dah hafal the sign and symptom, you will ask the parent one by one. Faham tak? You understand tak? At the end of the day, this is what inside your brain. Easy or difficult, it is all inside your brain. So this case, we don't know any wheezing tak clear. We don't know apa lagi? Using excessive muscle or not. We don't know the sinus, not sinus. We don't know the general condition, general admission, the child alert ke, irritated ke, irritable ke, tak tahu. Whether the child can walk or not during admission, tak ada orang tahu. Because nobody want to know the severity.
Doctor, in the HOPI, it stated that there is wheezing. There's a loud wheezing sound during when he expired.
Okay, at least mother can tell the wheezing. Atira, what the essence of the case?
This patient, a Malay boy, came with rapid breathing, 8 years old boy.
Bokis,
Yes, doctor.
what the essence of the case?
Uh, 8 years old Malay boy came with rapid breathing for 1 day.
Nurul Sofiana,
Yes, doctor.
what you think the essence of the case? Benda biasa perempuan tak dapat susah nak dapat.
8 years old Malay boy came to the pediatric ward due to rapid breathing for 1 day.
Maria tak nampak muka tau. Muka tak nampak apa nampak muka
8 years, 1 month old Malay boy came with complaint of rapid breathing for 1 day duration.
Afiq, 8 years old, with rapid breathing 1 day before admission.
Aduh, tak dapat juga. Jadi grup at least sampai tengah dia dah dapat dah. Aiman, you pergi Jepun ke? Ke Jepun, sekarang kat Jepun ya? Korea ke Jepun ni? Korea macam ni juga. Jepun. Orang semua dah gila-gila Korea, orang seorang lagi Jepun.
Tengok anime. Banyak tengok kartun.
Banyak kata apa?
Banyak kartun.
Banyak kartun. Orang semua minat Korea. Anak saya semua gila Korea lah. Dia tengok Korea apa tu, muka licin, handsome lah. Bersih licin dia nak patung. What the essence of the case?
8 years old Malay boy admitted to the ward because of persistent rapid breathing.
Akmal?
8 years old Malay boy with rapid breathing.
Budak ni ada apa? Basic background.
Asthma, with chronic asthma.
What's he having now?
Acute attack of asthma.
Susah sangat. This 8 years old asthmatic boy who are having apa? Apa dia ada sekarang? Having what?
Asthma attack.
Acute exacerbation. Different that approach you all. This is 8 years old boy with rapid breathing. This is 8 years old boy, asthmatic boy who having acute exacerbation. Approach you sama ke different?
Different.
Which one is more appropriate for this boy? You want to manage this boy, solve this boy problem?
Acute exacerbation.
That is the because you want to solve. You think, and unless you think the wheezing your child is having something else, you think the child having wheezing to something else. But mak pun cakap kan, anak saya kena lelah, betul tak? So mak perlu doktor ke dia diagnose anak dia kena lelah? Did the mom need a doctor? Kalau mom tak perlu doktor, kenapa you all have difficulty to diagnose? Mak pun boleh tahu anak dia kenapa. So this is a 8 years old boy asthmatic who having acute exacerbation. Because that's your line of thinking. So what next thing come to your mind?
The severity.
Severity kita dah answer dah tadi. What the thing come to your mind?
If he required admission or not.
That's why medical become susah to you all. Because you don't want to answer the problem the child is having. Your job is to answer the problem the child is having. The problem of this child is that this is an 8 years old asthmatic boy who are having acute exacerbation. Your job is to solve the problem.
To manage, how to manage this patient.
Give bronchodilator.
What is the come to your thought? To run in your thought. This is 8 years war with acute exacerbation of asthma. Run in your thought. What the next thing come to your mind to solve the patient problem?
What trigger the attack?
Why the child having acute exacerbation? Wah, first time perempuan boleh answer. Biasanya male ni yang otak dia macam tu. Simple dia. Perempuan dia fikir complicated. Satu benda dia 10 benda dia fikir. Lelaki yang fikir satu-satu. Tapi this one the female can answer. You all fikir complicated. The males are think very complicated. Because the issue is you want to answer why the child is having acute exacerbation. So what's possible but how you want to answer the question? What the thing you need to know before you can try to find the answer? The thing you need to know inside your brain, the knowledge you need to know, so that you can answer this patient punya problem. 8 years old asthmatic boy who having acute exacerbation.
You need to know what are the possible triggers that can cause.
You need to know all the possible triggers. Basically, you need to know all the thing about apa?
Allergies.
Or you think about apa? About the disease. Apa disease? Apa condition this case?
Acute exacerbation.
Apa condition the child is having? The child ada apa sekarang?
Rapid breathing.
Apa ya Allah?
Oh, asthma.
The child is having asthma. The child is asthmatic. So you need to know everything about what?
About asthma.
About asthma. If you know about asthma, only then you can able to answer the question that in your mind. Where you want to know about asthma? All those knowledge about asthma. Where you can get the knowledge? Where?
In the book.
In the book. In the internet. So why you read the book?
To gain knowledge, to gain more knowledge. To know.
Why you read the book? You read the book because you want to solve the
problem.
The patient problem. Selama ni you baca buku untuk apa? Nak pass exam ke nak solve patient problem? Ask yourself. Ikhlas. Selama ni. Tak tahu, tak pernah muhasabah.
So saya
Nak
kalau
pass
saya
exam.
dua-dua.
Most of the time you baca buku untuk apa?
Pass exam.
So kalau you rasa nak pass exam tu, you dapat barakah je.
Tak tahu.
Kalau you baca buku nak solve someone punya problem, so you baca buku nak pass exam, mana barakah dapat?
Both if it's lillahi ta'ala.
Ada. Lillahi ta'ala tu semua cakap je. Berapa ramai pada you betul-betul lillahi ta'ala ni? Teori je. Dah hidup you perasan ke lillahi ta'ala? Tak ada. You bukan sufi. Kalau sufi tasawuf, you sedar apa you buat lillahi ta'ala, tapi you ni manusia biasa je. Everything you makan sebab lapar, sebab ni you minum sebab dahaga. That's what we are. Itu ustaz tu cakap tu bohong je sebenarnya. Dia sendiri tak praktis. Orang sufi je yang minum kerana Allah Ta'ala sebab dia satu peringkat level dia tinggi tau. Dia sedar, dia always conscious about the God depan dia. Kita ni tak ada. Yang cakap lah Allah Ta'ala itu sebut bulut saja. Nothing else. That is what we are. You percaya macam tu, memanglah semua ustaz cakap Allah Ta'ala ni semua, dia pun tak, akhirnya kalau pergi cakap buat dapat 2,000 sekali cakap, sama je. Tak dapat, baru balik pada tu masam je. Kita tak tahu. So that the fact remain. You tahu betul barakah. You see barakah tu dapat pada orang Islam saja. You rasa kalau barakah tu masa orang Islam dia dapat. Tuhan punya. You tak tahu orang bukan Islam pun dia punya makhluk juga. Hamba dia juga. Kata you dapat barakah apa you baca. Macam mana you nak tahu?
Bermanfaat pada orang lain. Bermanfaat pada orang lain.
Orang lain. You mudah nak ingat, senang nak praktis. Benda tu dalam ni, dia keluar begitu saja. You baca sekali pun you dah boleh ingat. 2 kali pun you boleh ingat. Buat tahu you perasan you pekat. You tak boleh baca sampai 5 kali, 6 kali baru nak baca. Dia mesti nak ingat. You kena faham, Tuhan tahu niat sekali aku baca, you baca. You mungkin percaya, I belajar, you cakap, saya baca tu pesakit. Tapi most of the time, 80% of the time, you baca nak pass exam. Kena aku je lah. Kata tu India tu, bukan non-Muslim. Tapi dia baca sebab betul nak solve patient problem. You baca nak exam. Tuhan tu maha adil ke tak maha adil? Tuhan tu maha adil. Dia beri kepada orang yang menolong orang ni. That's life. Kadang you wonder kenapa orang tu dapat apa tu mudah pada orang lain. You kena decide lah. Macam Suhaib, kalau dia study malam tu, dia baca kes ni, dia study kes ni, dia tengok dalam baca kes ni, dia faham kes ni, lepas tu dia baca bab asma. Dia try to solve the patient punya problem bab asma dengan ilmu yang dia baca. Mana senang dia ingat? Kata you 2 minggu dalam exam, you baca pasal asma. Mana you rasa yang mudah nak ingat? This one is to solve patient problem. You ralik, pusing, patient ada symptom, wheezing, tak ada patient ni. Is it why the patient got asthmatic attack? This one, apa something go through you ni. Oh, dia ada ni tak, dia ni tak, ni tak, ni tak, ni tak. Ada kucing kat rumah ke, ada kapet kat rumah ke, ada apa ke, ni semua. Look through the case. So what the cause of asthmatic attack? Acute exacerbation. Suhaib. Give me the list of the cause of acute exacerbation.
In this patient or generally?
Oh, general dahulu lah.
Oh, generally. So some of the cause could be due to allergies, like seafood can be one of them, peanuts. As others can be like dust, carpets, cats. Others can be cold weather or cold drink even, and smoke. Some of the causes that can lead to acute exacerbation.
Itu je.
Oh, there is more.
Nanti kita buka. Kalau you dah baca malam tadi, ceni je you buat. You just tell me 10%, 20% je. 20% dia tau, daripada you baca. I can say, malam tadi saya tak study the case. Buka dia. What a waste of opportunity. Tuhan beri peluang, God beri you peluang nak belajar this case supaya you boleh jadi ini, belajar ingat pasal asma. You miss the opportunity. Cuti lah. Because I expected if you read, you will tell me how you present will be different. Sebab you tak baca, sebab ni. You baca tak malam tadi?
Baca.
Study about asma. Tell me the list of the list of causing of acute exacerbation.
Like I mentioned before, so this can be due to genetic causes. Another one, it can be due to atopy, and final one is due
Atopy
to
doesn't cause acute exacerbation.
Environmental trigger that can cause acute exacerbation.
Okay, triggers. How you divide the triggers? You see, I'm not going to teach you about knowledge because I expected you get the knowledge by yourself. It's very disappointed that I have to teach you all about knowledge. Even today pun you tak boleh nak tell me the knowledge of the triggers. List the triggers. How you list the triggers?
So some of the triggers are pets, exercise, cold weather, cold drinks, foods like seafoods and peanuts, dust, also smoke, pollution, carpets, and also stress and any chemical fumes. Some of the triggers. Also, cockroaches is also a trigger.
Apa?
Bugs.
Apa? Pus?
Bugs, insects. Insects.
Insect apa triggers?
Cockroaches.
Cockroaches. That's not an insect. Cockroaches ada berapa kaki? 6, 8.
6.
So consider as insect. Lagi?
Upper respiratory tract infection, URTI.
The most important in children, nama nak keluar. All the viral, rhino, metamor, RSV, What's the other thing can cause acute exacerbation other than triggers? Tak ada idea.
No.
Balkis?
I don't know.
Consent ya. Nurul?
I'm not sure.
Anybody? Non-compliant to medication, inadequate medication, the disease become more severe. Perlu ke benda tu? Nak tu?
Perlu.
Perlu ke nak benda tu, apa tu, nak benda tu susah nak fikir benda tu? Susah nak fikir benda tu?
Tak susah.
Ha?
Tak.
Why is it become difficult to think of that? Tak tahu kenapa. I give you the answer. Because you think complicated. Kalau you think simple, you dapat tak answer tu. If you think simple, think simple, keep it simple. Can you think of that? Think simple, common sense. Kalau you think complicated, tak jumpa lah. Why? Because this only common sense. That's all. Think complicated. So you faham kenapa medicine difficult to you all?
Faham.
Kenapa? Why medicine become difficult for you all? Because you all think
complicated.
You all thinking complicated. Siapa yang menyusahkan diri sendiri? Make you all suffer. Siapa?
Diri sendiri.
Yeah, you all. Medicine easy je sebenarnya. Just common sense. Ni. Think simple. Asma knowledge. You baca dalam buku, dalam internet, you dapat dulu kita baca library cari buku. Sekarang you buka internet je. Boleh baca pasal asma. You kelak buat discuss about asma, you baca dalam asma tu, you tengok apa dalam kes ni ada, apa kes ni tak ada. You thinking about severity. Severity kalau dalam otak you dah ada severity tu, you dah automatically you dah check dah severity of asthmatic attack. It's inside your brain. Simple je. That's all. Because if it's not inside your brain, tak ada lah, you don't search, you're not going to ask for it. But if it's already inside your brain, you're going to ask for it automatically. So it's either inside your brain or not inside your brain. Tu je. You have to decide you want to put it inside your brain or not inside your brain. So the thing is how you susun the thing inside your brain. So this Syah dia bila dia start kena asmatik, Suhaib?
He was first diagnosed asthma 1 year ago.
Age berapa?
He came first time he was diagnosed at age 7.
Berapa umur dia?
He was first diagnosed with asthma at 7. Now he's 8 years old.
You see, okay, they diagnosed asthma almost at 7 years old. A
Yes.
year ago. How they diagnosed asthma?
He was diagnosed with rapid breathing, coughing, and runny nose.
Admitted tu tak? Ward tak?
He was admitted to the clinic and was given nebulizer, and it resolved.
Admitted to the clinic. He went to the clinic lah, give
Yes.
nebulizer. And then there was diagnosed asthma, tak admitted pun.
No.
Then after daripada daripada umur 7 tahun ke 8 tahun tu, apa yang dia, berapa kali dia masuk ward? Tak ada.
He didn't tak masuk ward, tapi dia macam had same symptom for twice of
recurrent shortness of breath.
Yeah, and then got nebulizer.
Given nebulizer, how many time?
It was not mentioned. It just said had symptom for twice and rapid breathing was relieved after using a nebulizer. So
For a few times. 3 kali dia go to clinic, nebulize and
resolve.
When was started given MDI Ventolin?
That was not stated. No.
Not done. Or any given any apa tu, preventer tak? Tak ada.
No.
None at all. So that's they go to school. Ada miss school tak during that time? That 1 year tu?
No, it was not mentioned.
Not mentioned. No.
Yes.
Able to play or not during that time?
During that 1 year time? It was not mentioned as well.
Bukan, tak tahu.
But the school is only to the current presentation, not the previous presentation.
Ya, saya tak tahu, not mention. Waktu any follow up in the hospital, clinic during that time? Tak ada.
No as well.
Tak tahu. Then for this episode, apa jadi?
For this episode, they have rapid breathing before the admission.
Ada URTI dahulu tak? Semua batuk ke?
There's coughing, there's coughing, and there's a phlegm production, which is clear.
Ada batuk, cough, ada runny nose.
There's runny nose and there's cough.
Ada runny nose, ada cough. How many days before shortness of breath?
1 day before admission. 1 day.
1 day.
A week. It said here that a week before rapid breathing, he had episode of cough and runny nose.
A week before admission. Then after that, will they start shortness of breath? How many days before admission?
1 day before admission, have shortness of breath.
Shortness of breath, wheezing.
Yes.
Wheezing. It goes to the clinic, is it?
Yes. First go to clinic, get nebulizer, but not resolved, so it got admitted. Go to ED.
Go to ED. Noted that at that time tachypnea and ada talk influences.
Yes.
Tak tahu cyanosis, tak tahu going accessory muscle, can walk or not, tak tahu. Can drink, tak tahu.
That was not in the HOPI.
Yeah, drink or not, tak tahu. Waktu saturation in ED, tak tahu.
If it's in the physical examination, it is stated, but not in the
admission 2-3 hari sebelum admission.
It was not in HOPI.
On ED, tak tahu. So the chair was given at ED, they were given IV drip ke, and every nebulizer and given hari ada cough pun tak tahu.
It was not stated.
Settled. The chair was admitted. Then during that's 2 weeks, dia ada tak night cough, morning cough, the first few months, or exercise induced, tak tahu.
He experienced rapid breathing early in the morning. He experienced rapid breathing early in the morning that woke him up.
Usually they have that one early in the woken up for past few months like that. Tak tahu.
So he started to experience.
What the child will trigger? If the child having URTI, kalau kena cats, kalau masalah makan ke, atau if the child is kena carpets ke, it will trigger the acute exacerbation. Tak tahu.
No, it wasn't stated the trigger as well.
Okay, well, the second thing is that betul dekat rumah ada carpet ke, cats,
No, it was that was not stated. It's just for any
Rumah dia
allergy.
tepi jalan ke, very dusty, lori banyak ke? Tak tahu.
For the house, it is. It was all is stated for the housing area. It's just a dengue prone area.
Itu saja. Apa kaitan dengan asma pun tak tahu. Dengue prone area tu.
No.
So, orang tulis tu kan, dia memang tak study the case. Faham tak? Lepas tu, then the other thing is that mother is asthmatic, father is asthmatic.
Father is asthmatic, mother is not.
Mother is not. Budak tu ada eczema tak?
Yes, the child have eczema.
Budak tu ada allergic rhinitis symptom tak?
It's that he had allergic rhinitis when he was 4 years old.
4 years old. And treatment tak tahu?
Treatment, no.
No. So, ada sibling dia asthmatic.
Yes, sibling dia not asthmatic but have allergic rhinitis. Some have asthma, some have rhinitis.
The disease affect the child punya activity, sekolah semua, tak tahu.
For that only mentioned that on the day of the, like prior to admission.
Sajalah, tapi in term of the child punya activity, sukan, don't know.
Yeah, throughout the year, no, only before admission.
So what difficult about asthma? Finish already. Susah. I'll ask you one question. If you have the knowledge of asthma like ni, when you clerk this case, when you present, would it be different or not? Daripada apa yang you present sekarang ni, different or not? Is it going to be different?
It will be different.
Ya, itu berkat ilmu, faham? Ilmu tu you dapat digunakan untuk kebaikan orang. Ilmu tu kalau niat nak guna untuk kebaikan orang, dapatlah berkat dia. Kalau ilmu tu digunakan untuk pass exam saja, supaya dapat gaji besar dan sebagainya, setakat itu saja you dapat. Susah. Look back. Is it difficult? Where the problem is? Tell me which part is difficult. Complete already about asthma. Which part is difficult? Ada tak part difficult? Where is it difficulty? Apa susah medicine tu? Susah?
Senang.
Huh?
Senang je.
So where's the problem is?
Probably the problem when the doctor not clear the patient more thoroughly, macam case kita ni yang banyak.
You tahu tak, I can clerk this case in 10 minutes, 20 minutes ya, don't need 1 hour. I can solve all the patient problem. I can know whatever I want to know. I can do thoroughly lah. Tak payah 1 hour pun. 20 minutes I dah boleh clerk lah. So I know what I need to know. Because I know what I want to know. Do you know what you want to know? You need to know.
Some of it. I know some.
Just clerk saja kan. Lepas tu hopefully think mereka dapat. If you want to clerk, you know what you want to clerk, what you want to ask. and then you clap, and then you just clap because you just hoping that you dapat macam apple jatuh kepala kan. Dapat ni. So where is it the problem? As I told you, how you decide which part of you and decide the medical ni difficult? Which part decide the medical ni difficult? If your brain decide the medical too difficult, so the medical will be difficult. Betul tak? If your brain decide the medical is easy, the medical will become easy. Tak percaya? Still don't believe in that. Don't trust yourself. In the exam, still 90%, more than 90% pass. If the subject is more than 90% pass, 95%, 90% pass, the subject is difficult or easy? If the subject is difficult, how many percent should pass?
Only a little should pass if it's difficult. A little.
Pardon?
Only a few would pass if the subject is difficult.
So in medicine, how many percent pass?
A lot.
A lot. More than?
More than 50% pass.
More than 90%, 92, 95%. So you tell me why you say medical is difficult? Why medicine difficult? It's difficult. If you enjoy it, would it become difficult for you?
No.
You're passionate. Will you become difficult for you?
It would be easier.
Yeah. So who decide why is it become difficult? Is it the subject is difficult because your heart and your brain you decide it's difficult? Is it your heart or your brain decide it's difficult, or really the subject is really difficult? Ask yourself. If 20%, 40% of you pass, you can say lah, doctor memang difficult because majority of us fail. A lot of us fail. So if you enjoy it, it become difficult. If you passionate about your learning, would it become difficult? Okay, anything you want to ask? Tanya apa tak? Ada apa nak tanya? So in conclusion, medical ni difficult ke tak? As per subject per se.
Should be no. No.
You decide lah. I tak tahu. Because they are different people, different dia punya tu. I tak tahu. I don't know. Masa I student tu tak nak terlintas pun susah atau senang. Because we just teruskan, continue to live. Susah atau senang, kena hidup juga. Still need to live. So tak ada isu susah atau senang. Susah atau senang menyusahkan dia hati kan. Apa nak susahkan hati? You still have to live, continue to live juga. See, at the prime your life, you see prime your life sebenarnya is where you're 20 plus. 20 plus is where you're supposed to, you dah ada anak, you ada suami, isteri, banyaknya responsibility. Tahu tak? Pening kepala. Ni job, ni nak tulis, ni deadline habiskan, dan habis tu Don't you know? No, your life it's the best time of your life. Kenapa you nak susah, nak jadikan hidup you the best time of your life? Dia nak jadikan hidup you dengan susah hati. You won't get this time anymore. Once you dah anak, besok risau, anak demam, anak sakit ke apa ke, punya dah risau semua. Sekarang siapa ada anak sini? Tak ada tau. So tak ada apa-apa. Tak ada responsible sangat, tak ada tu sangat. Tak perlu fikir pasal rumah, hutang kereta. You kena bayar hutang kereta, hutang rumah. Ada? Tak ada. Nak beli kereta Mercedes ke, nak beli kereta X70 ke, pening kepala. You nak beli apa? Kereta Honda ke, hati nak beli kereta BMW, duit tak ada. Kan? You don't need to think all those things. Your taste dapat motor pun happy lah. Dapat motor, happy, enjoy with the motor. Itu dah susahkan hati, susahnya lah medical ni. Why you who decide to suffer? You ataupun ni? Hati you yang decide nak suffer. Any question? Tak ada question, finish lah. Apa? Tak enjoy the life. Banyak nak baca. Ni rushing dia. Ya. Nak fikir apa nak masak tengah hari ni. Ya. You masak ke? Tak ada kan? Mak masak lah. Tak beli kedai. Don't you know that this is the best time of your life? In the life. The best time of your life. Cuma tak ada duit je. Ada sebenarnya bagus. Tuhan tak, at this stage you tak ada duit banyak. Pegang cakap. It's good for you to have a lot of money at this stage. So you can focus apa yang you punya minat. Kalau you ada a lot of money at this stage, banyak masalah. Believe me, a lot of problem. It's a blessing in disguise. Tapi at my stage you kena duit banyak lah, no choice lah. So you nak hantar anak belajar, anak nak pergi universiti, anak ni, you need money. How to send ni? You no choice. You nak rasa kereta BMW sebelum mati, at least once you rasa kereta Mercedes. If you can afford it, your stage tak payah fikir. Okay, psikoterapi ya. Psikoterapi lah ni. Tak ada masa nak bentuk pemikiran you all. Bukan you all ni masih lagi fleksibel. You reach at my stage tak boleh bentuk lah. Your stage where you develop you punya minda. Only you can decide what you want to be. At my stage, you dah ikut arus tau. Choice, you ada boss, bawah you ada ni. Kat rumah balik ada bos lagi. Bos rumah lagi dahsyat. Okay, finish. Tak ada question Okay, sudah. Okay.
Thank you, Doctor.
Thank you, Doctor.
Thank you korang.